Dr. Beebe out here. It's time for our medical term of the day. This is going to be a somewhat difficult and abbreviated topic because the topic is so large. Somebody requested that I do this, but I may have to break it up into several different topics. And the topic today is congestive heart failure. First off, let me just say I hate the term congestive heart failure. It gives you the connotation that your heart has failed, that it no longer works, that it's not pumping. Well, that's not true. Congestive heart failure should be named congestive heart insufficiency or heart insufficiency. The heart still beats, the heart still pumps. It just doesn't do it as well as it should or used to. Now, congestive heart failure can be broken up into right and left, and they each have their own different symptoms. The main cause of right heart failure is left heart failure. And what happens with left heart failure is your left ventricle gets stiff or weak, and it will not pump blood out efficiently to the rest of the body. So you can end up with low blood pressure. Fluid will back up into the lungs, and then you have shortness of breath. You can develop chest pain. So left heart failure is more of a shortness of breath, chest pain related heart failure. Right heart failure, on the other end, is the blood is not pumped from the right side of the heart over to the left, over through the lungs. And so if blood backs up from right heart failure, you have swelling, enlarged liver, what's called pitting edema in your legs. You can develop ascites, which is fluid collection in your stomach. You can have both. You can have right and left heart failure. Major causes of heart failure, regardless of the size: past heart attacks, poor blood supply to the heart, viruses causing a cardiomyopathy, untreated high blood pressure. These are several things. Diabetes can bring it on as well as valvular heart disease, where a valve fails and blood is backing up because of that. So there's many ways that this can be fixed, from surgery to different procedures. Medications are very effective. They're not going to cure it, but they can sure make your life a whole lot better by being on the appropriate medicine and having the appropriate treatment. So if you have congestive heart failure, or have been diagnosed this way, or have a tendency to develop that, then there are some warning things that you should be aware of and reasons to call your doctor. If you get suddenly short of breath, if you have sudden chest pain, if you feel faint or weak, overly fatigued more than usual, but if you should gain 2 or 3 pounds overnight, or have a sudden increase in swelling in your legs or your abdomen, you need to call your doctor and let them know. You need to be reevaluated and your medicine needs to be readjusted. So there's a short little treatise on congestive heart failure. It can go on and on. There's lots of things to discuss with that. If you have any further questions, post them in the comments. I'll be happy to try to answer them. Thanks.